next manipulation, and that's drawing up. So before we draw up, this is where we're going to, I'm gonna go. Hang on, I need to make a shadow on tape for myself. You kind of gotta see it through once it's started. But this is gonna be our first technical manipulation. So when I use that word manipulation, this is going to be an act of that's related to making the compound. We're going to be removing fluid from this vial and getting it into the syringe. And then at that point, I'm going to go ahead and recap. So another thing that we would make is injections. So where the medication is just going into a syringe, and that syringe is the final container. It will get labeled and packaged and sent to the floor as it is. So this would be an example of a draw up for a syringe. So my vial is in the middle of my DCA. I remove the cap, and then I alcohol it off. Now, hear me. I remove the alcohol pad. I take it across the top firmly, once, twice, done. So you notice I did it in the same direction, twice, done. Okay? No scrubbing, no, like just 1, 2, done. And now it has to dry. If you do not allow the alcohol to dry, then it hasn't done its job. And you can also introduce alcohol into the compound. So the only way alcohol works is if it's dry. The whole purpose. It saturates the germs, pathogens, whatever is on there, and then it poof as it evaporates.